Leucovorin for autism? Here's what this week's announcement actually means and what the data show. Hey, it's Adam Sewell, MD. Quick update on leucovorin, also called folinic acid. You may have heard about a government announcement suggesting it could help with autism symptoms. Here's the truth. The FDA moved to make leucovorin available for a condition called cerebral folate deficiency, which can include autistic features. That is not the same thing as approving leucovorin for autism across the board. It's a narrower step focused on CFD. So what does the research say for autism itself? We have a couple of small, randomized, placebo-controlled trials. One study found that children with autism and language impairment who took folinic acid for 12 weeks had measurable gains in verbal communication compared to placebo. Another study from 2024 followed kids for 24 weeks and showed improvements on standard autism and behavior scales. Importantly, the benefits were stronger in children who tested positive for folate receptor alpha autoantibodies, which can block folate getting into the brain. In plain English, leucovorin seems to help some kids, especially those with evidence of a folate transport problem. It is not a cure, and it won't help everyone. If you're a parent, here's how to think about it. First, talk with your child's clinician about testing for folate receptor alpha autoantibodies. Second, if leucovorin is considered, it's a prescription medicine, and the dosing used in studies was weight-based and supervised by physicians. Third, keep proven supports like speech therapy and ABA in place. Medications are typically add-ons, not replacements. Finally, be careful with headlines. This is encouraging, but we still need larger trials before we can make broad claims. If this was helpful, save this video and share it with someone who needs a clear take. I'm Adam Sewell, MD.